Well, today on the show, we're in Moss Point on Main Street at We Care Hospice. And on the show with me today, Donna Holt, who is a director of nursing here at We Care Hospice, as well as Dr. Reginald Stewart, who is the medical director here. Thank you for being on the show today, Donna. Thank you so much for being here. Dr. Stewart, I'm going to start with you. What exactly is hospice care?
Glad to be here, Jim. Hospice care is care that we render to terminally ill people. They transition from patients to people who don't have long to live. And we realized years ago that we could do better with people who are quote unquote dying, who don't have long to live. We realized that the care that we used to give to those people could be better.
Make their final years or final days or whatever a very comfortable one.
Yes, yes, and that's the key word, quality of life, comfort care. Medicare realized that too much money has been spent in the intensive care unit, in the hospital, giving futile measures, futile care. And more so than that, making sure that they're comfortable, making sure that the families are taken care of, and making sure that not just me as a physician by myself, but the whole hospice team, the interdisciplinary team, gets together every week with the patient as a center and with the family and with the whole interdisciplinary team.
And of course, your major goal is to, again, make that person's life as comfortable as possible for whatever life that they still have left.
Exactly. The key word is quality of life.
Okay, and now we're going to take a walk back into one of the rooms and show you exactly, the types of patients that they do have and the type of care that they get here at We Care Hospice in Moss Point. Dr. Stewart, how is hospice different from palliative care?
Well, Jim, for one thing, most of the time people want to be at home. So the vast majority of our patients are taken care of in their own home. Now, this place is different in that it's set up different from the hospital. Sure, we do have some patients that prefer to be in the hospital, and some hospitals do have hospices, but this place is set up to be more like the patient's home.
Makes them feel comfortable.
Exactly, exactly, where we can render palliative care in the home. They're more comfortable here because they don't have IVs and heart monitors and nurses bothering them all the time, although we do have nurses here all the time. But for the most part, palliative care is taken care of in the home.
And how do they benefit from so much from the hospice care?
Well, the emphasis is on comfort, on quality of life, more so than quantity.
So that's what makes them feel more at home while they're here, because they know they're going to be well taken care of.
Exactly.
All right, let's find out more about what goes on here at We Care Hospice in Moss Point. We're in one of the nice rooms here. What types of patients can benefit from hospice?
Well, you would think, Jim, that most of the patients would be those that had cancer, who had failed chemotherapy, radiation, surgery. But actually, a lot of our patients have other conditions, such as end-stage chronic obstructive lung disease, congestive heart failure, dementia, and we do actually have qualifying criteria that Medicare mandates that we have, that Donna actually screens them for. They're very strict criteria that we have to follow per Medicare guidelines. And actually, probably about almost half of our patients actually have things other than metastatic cancer that we can actually render palliative care and comfort for those patients.
Okay, let's find out more now of We Care Hospice. Let's talk to Donna Holt. Donna, give us some information on We Care Hospice.
We began hospice care in 1998 in patients' homes, and in 2008 this building opened. We saw a need to take care of patients in the home, not only for those who don't have family members that can care for them, but for those whose family members are exhausted. Sometimes the end-of-life process starts out where you're able to do it, but the care gets so in-depth and so 24/7 that no family can handle that. So we bring them in. We also have respite care for our outpatients 5 days a week. I'm sorry, 5 days a month that Medicare pays for. And we have respite for non-hospice patients. So if you're taking care of mom and dad at home and you want to go on vacation, you can bring them in for a nominal fee, and they don't have to be hospice appropriate.
Because the caregivers do need a break.
They get terrible burnout, and we do a support group. We just partnered with AARP. and Irma Martin, and who does the Silver Alert for Alzheimer's and many other things in Jackson County. It's the Jackson County Triad Coalition.
Right.
And so we have on the third Thursday of the month a caregiver support group here so that caregivers can meet with each other and get ideas and to help find resources to ease their burden. And then on the fourth Thursday of every month, we continue to have our Alzheimer's support group. We've been doing that since 2008. 3 years ago, we started the Alzheimer's Walk for the Cure, so we're very involved in Alzheimer's, raising money for research, and it is one of the diagnoses that we deal with. We Care Hospice is special because we have like a 3-to-1 nurse-patient ratio.
Wow.
So we give individualized care. Dr. Stewart talked earlier about the team approach, and here we have social workers, chaplains, nurses, and doctors who all meet with that patient as our primary focus and their comfort and how we can better aid the family with other resources as well.
Well, you talked about raising money, different things like that. What about the We Care Foundation?
Thank you for asking. We Care Hospice Foundation is a 501(c) nonprofit organization that helps us pay for indigent care, patients who don't have funding or insurance. Each year we spend over $100,000 in uncompensated services, and our coffers are now bare. So we've started a fundraising campaign on GoFundMe.com. You can go to our website or our Facebook page and find out more information how to donate directly to those sites.
That was my next question. How do they donate to? How can they donate to that?
Go right to there. You can always put a check in the mail to 3725 Main Street, Moss Point, to our main address where we're located, or you can go to GoFundMe. You can call me at 228-623-5004 to make a donation. We can take care of you. Which brings us into how do you find hospice care? Please remember that when you're in a hospital and they finally tell you that we've done all we can do, it's time to do comfort measures. It is your choice. The hospitals all have different organizations that they partially own, and so naturally you want to promote your own business. So that's what I'm doing today too, is letting you know you don't have to go with who anybody suggests. It is your choice. Do the research. Look on our website. Read our testimonials. We give the best care in town.
Come take a tour.
Come take a tour.
Come take a tour, yes.
Come take a tour.
You'll love it. We're walking through the hallways. It's like, it's lunchtime. It smells so good in here.
It smells so good.
It really
we have
does.
zero tolerance for any kind of odors. We want this to be your home. We want families to come in. We don't have visiting hours. It's 24 hours a day care. We just ask that you make this your home away from home. And you know, we're so grateful to be part of your family during this terrible time.
All right. Thank you very much. Donna Holt,
Thank
Director
you.
of Nursing, We Care Hospice, Main Street in Moss Point. If you want some more information, as she said, go online, check out the website, or just stop by and visit. And if you'd like to donate, you can donate to the website on your screen.
Thank you so much.